Dr. Kate Tulenko joins me now. She's founder and CEO of Corvus Health, a global health firm. Dr. Tulenko, why do you think U.S. is lagging behind other countries when it comes to vaccinations, behind Israel and Bahrain, much smaller countries?
Well, as your commentator mentioned, the U.S. had hoped to vaccinate 20 million people by the end of 2020, but it looks like only about 2.6 million people have been vaccinated. And there are a number of different reasons for this. One seems to be the lack of planning, that there hasn't been planning either at the federal level or the state level to roll out the vaccine fast enough. Another idea is that not sufficient federal funds were given to the states to roll the vaccine out. States really have run out of money, so they don't have the funding to properly administer the vaccine. Also, another issue might be that hospitals are mainly vaccinating their own employees, and they don't really have a plan for vaccinating healthcare workers in the community.
I want to ask you about this nurse in California who had been vaccinated, then ended up testing positive for COVID-19 a few days later. These shots need more time to work, don't they? I mean, should we really be surprised that this nurse tested positive? I mean, patients don't immediately develop protection after being vaccinated, do they?
Exactly. This case doesn't surprise me at all. Either two things happened. Either she'd gotten COVID before she received the vaccine, or she got it afterwards. The immunity doesn't occur until probably 1 to 2 weeks after the second vaccine. And even then, it's only 95% effective. So we can expect people who received both vaccines to get COVID as well. So this is not a surprise.
The Oxford AstraZeneca vaccine, which has been approved for emergency use in the UK, is the United States going to follow suit? And what makes this vaccine different than Pfizer and Moderna?
So we expect that vaccine to be approved probably in April in the U.S. under emergency use authorization. And perhaps more people will accept that because it's not an mRNA vaccine. It's a DNA vaccine with an adenovirus. It's
what does that mean?
More traditional vaccine.
What does that mean, doctor? Most people don't know the difference.
So yes. So the AstraZeneca vaccine has the spike protein of the COVID placed in an adenovirus, which is a very common type of cold virus that humans get. And the virus has been modified so it can't replicate. But when injected, the virus will enter the person's cells and it will produce the spike protein, which the person then launches an immune response to. Also, the AstraZeneca vaccine doesn't need to be kept at these extreme cold temperatures, so it'll be much easier to roll out. Also, we expect in the next 2 months, the Johnson & Johnson vaccine will probably be approved as well, and that's a single shot, so that has a huge advantage as well.
But do you think the AstraZeneca vaccine and the Johnson & Johnson ones are going to be just as effective as Moderna and Pfizer's?
Probably not. We've seen certainly lower effectiveness in the AstraZeneca. We're still waiting for the results from Johnson & Johnson.
All right, we'll leave it there. Dr. Kate Tulenko, thank you.
Thank you.